The lines that I had here on my face prior to Restylane were deep, and I honestly didn't know what could be done about them. I hated the way they looked, and ever since I've had the treatment with the Restylane, you know, right over here on my face, they're gone. I look much younger. I wanted to show off my new look to everybody, everybody from family to friends. I've had many compliments, and recently I've ran into some friends who I haven't seen in a long time, and the first thing they said was, "You look amazing," and of course they couldn't quite figure out what was different. My greatest concern before having any Restylane treatments was probably pain or an unnatural look. After my treatment, I was able to resume normal activities. As a matter of fact, I asked the doctor if I could work out later that day, and he said absolutely, and that's what I did.
The Restylane family of products includes Restylane, Restylane L, Perlane, and Perlane L. These products can be used individually to add volume and fullness to the skin to correct moderate to severe facial wrinkles and folds, such as the lines from your nose to the corners of your mouth, nasolabial folds. Ask your healthcare professional which is right for you. Important safety considerations for the Restylane family of products. Products in the Restylane family should not be used by people with previous bad allergies, particularly to certain microorganisms known as gram-positive bacteria, or by people with previous bad allergies to drugs that have required in-hospital treatment. These products should not be used by people with bleeding disorders. Injections should not be made anywhere except the skin or just under the skin. Restylane L and Perlane L should not be used by people with a known allergy to lidocaine. Use of products in the Restylane family at the site of skin sores, pimples, rashes, hives, cysts, or infection should be postponed until healing is complete. Use of the products in these instances could delay healing or make your skin problems worse. After your treatment, you might have some swelling, redness, pain, bruising, and tenderness. This will normally last less than 7 days. In rare circumstances, the doctor may inject into a blood vessel, which can damage the skin. Although rare, red or swollen small bumps may occur. If you have had facial cold sores before, an injection can cause another outbreak. To avoid bruising and bleeding, you should not use the products if you have recently used drugs that thin your blood or prevent clotting. If you are pregnant, breastfeeding, or under 18 years, you should not use products in the Restylane family. Patients should be limited to 6.0 milliliters per treatment. The safety or effectiveness of products in the Restylane family for the treatment of anatomic regions other than nasolabial folds have not been established in controlled clinical studies.